When I was young, my father was diagnosed with multiple sclerosis, or MS. That was a pretty debilitating neurological disease for him. So watching him kind of struggle with that and accompanying him to his doctor's visits to a neurologist specifically really left a lasting impression on me as a child, and kind of paved the way for me to pursue a career in medicine. Hi, I'm Dr. Islam Fayed, and I'm a neurosurgeon with Cooper and Inspira Neuroscience. My main area of focus is stereotactic and functional neurosurgery. So that involves deep brain stimulation and other techniques for movement disorders, most notably Parkinson's disease and essential tremor. Every patient has their own story and their own type of pain that they've developed over the years. So we really try to spend some time with each patient, get to know them, get to know how their pain is affecting them and where it's coming from. Once we're able to understand where the patient's specific type of pain is coming from, and we get them through their more conservative measures like physical therapy, medications, injections. Once we determine that they're ready to explore surgical options, we start that process, and we're able to explore a number of different options and try to pick the right option for each patient. Deep brain stimulation is a bit of a misnomer because it makes it sound like it's a lot more invasive than it truly is. But it basically involves a couple of small incisions, very small openings in the skull. We're not opening the skull in a traditional sense and looking at your brain. Very small openings, and we use different techniques, stereotactic techniques, robotic techniques to help us accurately place electrodes into certain parts of the brain that help modulate the motor circuitry of the brain to help with the symptoms of tremor and other movement disorders. Those wires are then tunneled below the scalp and connected to a pulse generator in the chest, similar to a pacemaker. I think the most rewarding situations are where a patient is relatively active, but then becomes debilitated by pain from a structural reason of spine, such as a disc herniation, for example. When we offer surgery to them and remove that disc herniation or whatever that structural problem was, and their pain goes away and they resume their lives almost immediately afterwards, those are the most rewarding and satisfying types of cases.